Hi, Dr. Brian Koffman, a retired family doctor and a CLL patient myself, chronic lymphocytic leukemia patient, and I'm the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society.
Hi, I'm Karen Jones, executive director of the WAHA Warriors.
So, before we go any further, WAHA Warriors, what does WAHA stand for?
It stands for Warm Autoimmune Hemolytic Anemia.
So we're going to have to unpack that a little bit for our population, and let me start. As we both know, chronic lymphocytic leukemia is a cancer of the immune system. And patients with CLL are immunosuppressed and are at higher risk for infections, but they also have significant immune dysfunction and autoimmune problems. And those can be a problem in where the body attacks itself.
Exactly.
And the most common is autoimmune hemolytic anemia. There's others. I myself have had where it attacks my platelets, which are involved in preventing bruising and bleeding, and that's called immune thrombocytopenic purpura, which is a big fancy name, and the short is ITP, but it can attack the red cells in a different way called red blood cell aplasia. And it can even attack other parts of the body, the liver, the thyroid, and stuff like that. So we can get all these autoimmune dysfunctions. And I know you're not a physician, so I don't want to put you on the spot. So autoimmune is when the immune system goes rogue and attacks itself.
Absolutely.
But explain to us what autoimmune hemolytic anemia is specifically.
So warm autoimmune hemolytic anemia, it can present as primary or as secondary. And in many cases, when it's secondary, it is with CLL patients. Primary, it's idiopathic.
Idiopathic means? We don't know.
We don't know.
Like it's the same source word as idiot.
Exactly.
It means we don't know what the causes were.
Yes.
Yeah.
And so our patients then, what happens then in WAHA is that the body is destroying, the spleen is destroying our red blood cell count. And when that happens, then we have a multitude of symptoms, including heart palpitations, breathlessness, extreme fatigue, jaundice, that kind of thing.
Lightheaded, standing up, things like that. And it can be life-threatening. People can have heart attacks.
Absolutely, it can be.
And it's warm because it happens at the core body temperature.
Yes.
And in CLL, that's caused by that's the most common. That's 80% of the cause in CLL. 20% is cold, and that's a different antibody, and it's only in the extremities and where the body is cold that the damage is, and it's a more complicated process. But the warm autoimmune hemolytic anemia is these pathological antibodies, immune globulin G, which is the most common antibody, and we may have shortages of it, but what we have may be dysfunctional, and that leads to it. So there's, I'm just going to touch a little bit on the treatment. There's a lot of different treatments for autoimmune hemolytic anemia, and generally they involve suppressing the immune system so it doesn't attack the body so much. But there's some new research going on. Is your organization involved in any of that research, or trying to get the word out about the research that may be a little less immunosuppressive?
Well, what I know is that we have a number of clinical trials out now. And we point our patients to clinicaltrials.gov to see what the latest is and where they're located to see if they would qualify.
So tell us what your organization does and how people could find it. And I'm assuming, because we're a secondary, we'd have secondary warm autoimmune hemolytic anemia. They usually leave the word warm off in the CLL community. So we have the secondary autoimmune hemolytic, it's secondary to our cancer and its immune dysfunction. But I assume we'd be welcome in our group, and I would let you know if you're in the CLL Society. You can join whatever groups you want besides the CLL Society. So tell us about what services you have, how people can find you.
Absolutely. We are a 501c3. We actually debuted at ASH in 2020, which I think was virtual that year. That was before I came aboard. So what we do is we offer our patients education, information, support, resources, and a community that they can then find other people who also have WAHA. So we have our biggest patient source is our Facebook page, and we have a private Facebook page for patients and caregivers, and then we also have a public Facebook page for our industry partners and our hematologists, and we have some med students who like to follow us and things like that. We also have other social media platforms. We have Instagram and Twitter, those kinds of things. But Facebook is where most of our patients are found. We do a lot of polls to find out exactly what our patients need from us, and then provide that information to them as timely as possible. We have an amazing patient advisory board and a medical advisory board as well. And we really try to meet the patients wherever they might be in their journey, whether they're newly diagnosed or whether they've had the condition for quite some time. If they've found a treatment that tends to work for them, that's wonderful. They'll share it on the forum, and other patients then will chime in as well. And they like to do that. They kind of compare their symptoms and their treatment, and in the long run, everybody just wants to feel better.
And you have a website too?
We do. It's wahawarriors.org.
Okay.
Yes, and you can sign up for a newsletter there.
And can you spell WAHA just to make sure everybody gets it?
It's WAIHA.
Okay.
wahawarriors.org. They can sign up for a newsletter that we do quarterly, as well as we do quarterly webinars. And we're new. We're very new. So so we just have a few of them out now, but we are growing every day, and we'll be putting some more programs out in 2023. We also have our first annual meeting. Our first annual patient meeting will be in New Orleans, and it is March 24th through the 26th.
Cool.
Yeah.
And will you have hematologists?
Yes.
Yes. So this will be a chance to learn the latest on what the new treatments are, what the new trials are, what's going on.
Absolutely. Yes. We'll have industry there, and I just spoke with Dr. Arena, and we are planning to have, she's going to do a session on splenectomy, because that tends to come up in our community quite frequently. And then we'll have some other things. We'll have a professional that deals with mental health resources for the chronically ill and rare disease patients. I'm really looking forward to that. And we'll have some legislators, some local legislators, just to be able to let our patients know how they can become more actively involved.
Well, I'm interested. I've had a splenectomy for my ITP.
Exactly.
So I know the risks and benefits of splenectomy on a very up close and personal level.
I'm sure.
Well, it's very exciting, and it's also kind of heartwarming to me, because having my wife and I having co-founded the CLL Society, I remember those early days of getting things going and getting up on the web and doing our first meeting, and how the trepidation, and is it going to work, and is anybody going to show up, and
Right.
But it's really exciting and really important work that you're doing.
It is.
Are there any final words you want to say to the CLL community? Because obviously it's kind of a Venn diagram, but the overlap is relatively small. We know, depending on who you read, there 5 to maybe as high as 30% of CLL patients will get autoimmune hemolytic anemia.
Yes.
And of that, about 80% of it is probably warm autoimmune hemolytic anemia. So there is some overlap, but it's, most CLL patients, this is not in their history.
Right.
But is there anything you want to say to our community that you think, or to the general community?
Yeah, absolutely. You're welcome to join us, I guess is our message. We also work with CAD, and we're hoping that they will, this is a cold agglutinin disease, we're hoping that they will also join us at our annual meeting. We're having during that meeting will be our AHA Awareness Day. And so that, I think, is pertinent to a lot of patients, whether you're a CLL or you're not CLL. But yes, come and join us.
And we're big at the CLL Society. We like to call ourselves sort of the Kumbaya organization, trying to work with everybody and to increase awareness, because especially for these rare disorders where it's just so hard to get anybody's attention.
Sure.
So I'm excited to meet you. I had the pleasure of interviewing Dr. Irina, and I look forward to that. So let's stay in touch, and we'll put up links on our website to your Facebook page and to your website, and to when the when you have the live event, we'll
That'd be
make sure
wonderful.
that people that are interested in it
That'd be
can
great.
attend that.
We appreciate that.
Thanks so much. So nice to meet you here in New Orleans.
Thank you. It's nice to
Thanks.
meet you as well.